Recall that we don't get improved outcomes in a multi-tiered system of supports unless we have all three of these equally important aspects functioning together. This section has been all about assessment in a multi-tiered system of supports, here in the pink. The role of general outcome measures, known as screening and progress monitoring tools. We need to understand how these assessments differ from mastery measures, common assessments in education, so we can use them correctly to inform our MTSS practices, here in the dark blue. At Tier 1, it informs school improvement, not the purpose of this course. At Tier 2 and Tier 3, it informs targeted group and intensive interventions. These database protocols or decision rules are operationalized into systems, here in the light blue, to assist the adults, such as a map that communicates a clear vision of data use at Tier 2 and Tier 3. Beyond Tier 1's school improvement use of screening data, we next use screening data to respond to or target students' needs. Screening measures are often global tools that may be good at telling the who and the level of urgency or intensity of a need. Some screening tools aren't strong at identifying clear targets for students' instructional needs. But at a Tier 2 targeted group intervention level, we need clear targets. If a screener has multiple assessments aligned to foundational skills like DIBELS, AIMSweb, and Acadience, then the pattern of strengths and needs across those can be the first information regarding the targeted group needs. If not, often intervention programs have a diagnostic pre-assessment that can be administered to those who are targeted for intervention to determine needs aligned to the intervention. Either way, we should have a clear, data-based idea of what targeted instruction should be to inform our system. So to recap, we screen with a general outcome measure predictive of future success in reading, math, or social emotional skills. And then we either use the data inherent in that, when it's designed that way, or a group diagnostic to drill a bit deeper to identify targeted needs. And then we target the intervention to that need and intensity. But it isn't just about handing the student off to others. MTSS is a collaborative approach to fluidly using all resources. All students are receiving core Tier 1, and these needs should inform that as well. Some students are also receiving targeted supplemental standard protocol Tier 2 intervention, and a few other students may need all of the above. As you can see, a system that functions this way would need to be much more collaborative than send the students in the red down the hall to the reading specialists. This will only work when we all work together, and the students with the most need should be getting the most support. We must monitor at least the students receiving intervention by the guidelines set in the General Outcome Measure Progress Monitoring Tool Manual. This is typically the same tool as the screening tool, and we must set a goal based on norms and the benchmark, and students may exit intervention when they meet the benchmark and close the gap.